What is going on? It is 5:30 a.m. Today is that's right, April. April 26, 2021. We are living today. Check it out. We're gonna go ahead. There's an exam today. There's an exam today around 9, around 9 a.m. around that time, between 9 and 11. And so we're gonna go ahead and go through the bones, actually the muscles of the lower limb. Origin, insertion, action, innervation. We're going to go through the hip region. We're going to go through the thigh, the leg, and we're going to talk about these muscles. So this is a review. This is practice. This is review. So this is just to kind of get your mojo going before the exam. You're ready already. You're already ready for the exam. But this is just a review. So we're going to hit that up. Then we're going to do cranial nerves and foramina. Yeah, we're going to review the cranial nerves and foramina, and hopefully, this review will end, maybe an hour or two right before your exam. You can get us some water, take a little 20-minute nap, go in there, ace the exam, and let me know how you did. I know you're going to pass. I had a student. There was a student last semester who got into the nursing program. She's in the nursing program right now. Got a few students like that who just reviewed and practiced every day. We met 20, 30 minutes a day, and now they're in school. Now they're in their program. So keep it up. Keep going to class. Listen to your professors. You know what to do. Get it done. Gluteus maximus. And so we're going to talk origin, insertion, action, innervation for the gluteus maximus. Alrighty? So, what is what is the origin of the gluteus maximus? That's right. We can say sacrum, ilium, right? And what about its insertion? That's right. The gluteus maximus is going to insert. You see a little bit of here on the IT band, but also the gluteal tuberosity. And let's just take a closer look at that. And so we see the gluteus maximus originating there on the, that's right, sacrum here, and the ilium here. We can also see some origin here on the coccyx. And then our insertion for the gluteus maximus, where we see it inserting here on the, that's right, the femur bone. But it's also going to insert on the IT band, or even the tensor fascia lata. Okay? Gluteus maximus. What about the action? What's the action for the gluteus maximus? What does it do? You see how it's extending that hip. Here's our gluteus maximus. Powerful extender of the hip. Okay? Innervation. Innervation for the gluteus maximus. Inferior gluteal nerve. You see it there highlighted, and it's coming off of that sacral plexus. Okay, so we went over origin, sacrum, ilium, insertion, IT band, gluteal tuberosity of the femur. Action, powerful extender of the hip. Innervation, inferior gluteal nerve for our gluteus maximus. Okay, so our next muscle we're going to talk about is the gluteus medius. Gluteus medius just lies deep to the gluteus maximus. You see it here. And so what I'm going to do is go ahead and reflect this gluteus maximus. And we have our gluteus medius here. Gluteus medius. If you look right below that muscle, right, just deep to that muscle, you have the gluteus minimus. Okay, so let's talk about the gluteus medius, origin, insertion, action, innervation, gluteus medius. So what's the origin for the gluteus medius? That's right, the gluteus medius originates on the dorsum of the ilium and the iliac crest. You can see it there. Here's our ilium. You can see it originating there. Okay, and the insertion for the gluteus medius is going to be where? That's right, the greater trochanter of the femur. You see that there? There's our insertion for the gluteus medius. What about the action? Action for the gluteus medius. And we can see it acting here. Abduction of the hip, stabilization of pelvis when in motion. Gluteus medius. Innervation for the gluteus medius. That's right, superior gluteal nerve. It's a branch of the sacral plexus. And you can see that nerve going through there to innervate that muscle. Gluteus medius. Let's look at the gluteus minimus. All right, this muscle here. Gluteus minimus. Origin, insertion, action, innervation for the gluteus minimus. What is the origin for the gluteus minimus? You can see where it originates there on the, that's right, gluteus minimus originates on the dorsum of the ilium. What's the insertion for the gluteus minimus? Insertion. That's right. Greater trochanter, right, of the femur. Here's our femur bone here, and we can see that gluteus minimus inserting there on that bone right there. Isn't that beautiful? Gluteus minimus. Action for the gluteus minimus. Action for the gluteus minimus. That's right. Abduct, right? Abduction of the hip joint. What about innervation? Superior gluteal nerve. It's a branch of the sacral plexus. Tensor fascia lata, and we'll talk about this one here. Origin for the tensor fascia lata. That's right. Right there. Right there. You see it on the iliac crest. Right here. Here's the ilium. And you can see it originated right there on the crest of the ilium. What about the insertion for the tensor fascia lata? What does the tensor fascia lata insert? That's right. It's going to insert on the iliotibial tract, right? The IT band, or the iliotibial tract. You can see them articulating here. Here's the tensor fascia lata. Here's the IT. So our origin, iliac crest of the ilium. And then the insertion for the tensor fascia lata is going to be the IT band. The IT band here. And the IT band is going to originate on the tensor fascia lata, and it's going to insert on the tibia, way down here. Tibia in the leg, right? Here's the IT band, and you can see its insertion down here on the tibia, okay? What about action? What's our action for the IT band? It's going to control those quads, okay? IT band. What about innervation? Innervation for the IT band. That's right, it's innervated by the superior gluteal nerve. Superior gluteal nerve for the IT band. So again, tensor fascia lata runs right into the IT band. IT band originates on the tensor fascia lata and then inserts down here on the tibia. IT band, iliotibial band of fascia. Okay, IT band. Okay, one more muscle we want to cover in this region, in the region of the hip, is the piriformis. What nerve is this? That's right, sciatic nerve. So that's your piriformis. The piriformis is one of the major causes of sciatica. Here's the muscle here, piriformis, right? And that muscle can get hard, swollen, and it'll actually put pressure on this nerve here, pushing it into the bone, okay? So remember that when you think piriformis, sciatica. Origin, we said what? Originating on the anterior sacrum. So if we turn the sacrum around, here's our sacrum, right? From last unit. And we can see piriformis right there on that ventral surface of the sacrum, running through that greater sciatic notch there. And then where's it going to insert? Where's the piriformis going to insert? That's right, the greater trochanter, right? Right here on the greater trochanter. You see it, we see it there. Greater trochanter, piriformis. That's our piriformis at work. So again, origin, anterior sacrum, our sacrum, anterior surface, we see it there. Insertion, remember it's going to pass through the sciatic notch of this os coxa, you can see it there, and it's going to insert on the greater trochanter of the femur. That's our innervation for the piriformis muscle. So what we have done is we've gone through the major muscles in the hip region. And it's really amazing because if you look at this, we've covered 1, gluteus maximus, 2, let's remove this so we can really see it, gluteus medius, that's right. And just deep to this gluteus medius, I'll go on this one over here. We have, what's that muscle there? Just deep to that gluteus medius. That's right, this muscle right here. Gluteus minimus, good, gluteus minimus. And we see inferior to that, these muscles here. That's right, running over that sciatic nerve. Piriformis, good, piriformis. We have this muscle here. That's right, tensor fascia lata, good. That tensor fascia lata runs right into this band of fascia here. What do we call this? That's right, the IT band, the iliotibial tract, band of fascia inserting on the leg down here in the tibia. I know this is a review, but make sure you go over it over and over again. Make sure you know your origin, insertion, action, innervation. Okay, all right. Those muscles of the hip. Let's get into muscles of the posterior thigh. Muscles of the posterior thigh. Posterior thigh. Posterior thigh. Let's get that. What is going on? This is Anatomy Review and Practice. I'm Mac, and we're going to go over the muscles in the posterior thigh. We're going to start with this muscle here. This is review, so you should be able to recall this. That's right, biceps femoris. We're going to talk about the, semi-tendinosus, and then, semi-membranosus. Okay, origin, insertion, action, innervation of these muscles. Can you give me origin, insertion, action, innervation for the biceps femoris? Let's start with the long head. The long head of the biceps femoris originates ischiotuberosity. Good, ischiotuberosity, and it inserts fibular head, right? The head of the fibula. Good. Okay. Here. That's the short head of the biceps femoris. Yeah, origin. That's right. Short head originates on the linea aspera. Here's the femur. And then here's our short head. Okay, linea aspera. Insertion. Insertion for the short head. That's right. It inserts together with the long head on the fibular head. Right there on the fibula. Innervation for the biceps femoris. Long head. That's right. The long head is going to be innervated by the tibial nerve, and the short head here of the biceps femoris. Innervation. Common fibular nerve. Good. Common fibular nerve. Okay. All right. Action. What's the action for the biceps femoris? What does it do? Yeah, extends the hip. Good. Lateral rotation of the knee. Lateral rotation of the knee. Good. Biceps femoris. Okay, let's talk about this next one here. The semi-tendinosus, right? Semi-tendinosus. What's the origin? What's the origin for the semi-tendinosus? That's right. It originates. Yes. Ischiotuberosity. Okay. What about insertion for the semi-tendinosus? Insertion. What does it insert? The semi-tendinosus. That's right. Medial anterior tibia. Right? Medial anterior tibia. Semi-tendinosus insertion. Medial anterior tibia. There's a tibia bone here. Semi-tendinosus. Okay, what about action? What's the action for the semi-tendinosus? What does it do? Semi-tendinosus. That's right. Extends the hip. Flexes the knee. What's the innervation for the semi-tendinosus? That's right. Tibial nerve. Tibial nerve. Tibial nerve. Good. Let's keep moving. Let's keep moving. How about semi-membranosus? Can you identify the semi-membranosus? Semi-membranosus. Semi-membranosus. That's right. This muscle here. There we go. Here it is on the right. Here it is on the left. Semi-membranosus. And what is our origin for the semi-membranosus? That's right, ischiotuberosity. That's right, ischiotuberosity for the semi-membranosus. Let's go ahead and reflect this semi-tendinosus so we can see that, semi-membranosus.
Insertion. Insertion for the semimembranosus. That's right. The anterior superior tibial medial condyle. You see it there. Here's the tibia. Anterior superior medial condyle. Semimembranosus. Tibia. Okay, insertion. What about action? Action for the semimembranosus. What's the action for the semimembranosus? That's right. Extension of the hip, flexion of the knee, extension of the hip, flexion of the knee, medial rotation of the knee. Innervation. That's right. Tibial nerve. So we've talked about these muscles in the posterior compartment. We talked about biceps femoris, both heads, right? Long head, short head, biceps femoris. We talked about this muscle here. That's right, semitendinosus. And then the muscle just deep to it, semimembranosus. Good. We talked origin, insertion, action, innervation of these muscles. And we just keep on reviewing them until we know them. Biceps femoris, origin and insertion. That's right, ischiotuberosity. Inserts, both heads insert on the fibular head, right? So the head of the fibula. Short head of the biceps femoris originates, linea aspera, good. And that's right, it's going to insert with that long head on the fibula. And then, you know it. That's right, semitendinosus, and semitendinosus originates, right, ischiotuberosity, inserts, medial anterior tibia, good, action, extends hip, flexes the knee, innervation, that's right, tibial nerve, semitendinosus. What about this muscle here? Just deep to that semitendinosus, yes, semimembranosus, origin, that's right, ischiotuberosity, insertion, that's right, anterior superior tibial medial condyle, okay, action, semimembranosus, extension of the hip, flexion of the knee, medial rotation of the knee, and then our innervation, of course, is going to be the tibial nerve. Hey, that's the muscles of the posterior thigh, biceps femoris, semitendinosus, semimembranosus. When we come back, we're going to talk about the muscles of the anterior thigh. Muscles of the anterior thigh, just to give you a little sneak peek. These muscles here, vastus lateralis, rectus femoris, vastus medialis, and we have several more we're going to get into when we come back. Muscles of the anterior thigh.
Yes. So we just finished muscles of the, that's right, posterior thigh. And now we're going to get into muscles of the anterior thigh. Muscles of the anterior thigh coming up next. This is exam day. And, you're already ready for the exam. This is just review and practice. So coming up next, muscles of the anterior thigh. Coming up next right here. Stay tuned.
And for clarity, we're talking these muscles here. Rectus, that's right, rectus femoris, vastus lateralis, vastus medialis, sartorius, and then, just deep to that rectus femoris, you have the vastus intermedius. So let's begin with the rectus femoris. So here's our rectus femoris here. And let's talk origin, insertion, action, innervation. Okay, so what is the origin? That's right. The rectus femoris originates on the ilium, anterior inferior iliac spine. You see it there. Where does the rectus femoris insert? That's right. It inserts on the tibial tuberosity. Rectus femoris. Okay. What about action? What does it do? That's right. Extends the leg, flexes the hip. Innervation. Innervation for the rectus femoris. That's right. Femoral nerve. Femoral nerve for the rectus femoris. Okay. What about vastus lateralis? The vastus lateralis. Vastus lateralis. Origin, insertion, action, innervation for the vastus lateralis. What's our origin for the vastus lateralis? That's right. That's right. Greater trochanter, right? Greater trochanter of the femur, linea aspera. Okay. What about insertion? Tibial tuberosity. Tibial tuberosity. Tibial tuberosity. Okay. Action. Action for the vastus lateralis. Action. Extends the leg. Good. Extends the leg. And what about our innervation? Innervation for the vastus lateralis. Yes, femoral nerve. Femoral nerve. Okay, let's talk about vastus medialis. Vastus medialis. Can you identify that muscle? Vastus medialis. Vastus medialis, that's right. Right here. Vastus medialis. Vastus medialis. Origin, insertion, action, innervation. Let's go. Origin for vastus medialis. Origin. Yeah, intertrochanteric line. Intertrochanteric line on the femur. Also, where else? Where else on the femur? That's right, linea aspera. Good. What about insertion? Insertion for the vastus medialis. That's right. Tibial tuberosity. You could say tibial tuberosity via the patella. How about vastus intermedius? That muscle, remember, is going to be deep to the rectus femoris. Vastus intermedius. See, it's just deep to the rectus femoris. And I've on the left side, well, your left, you can see the rectus femoris is faded, and deep to it, you can see the vastus intermedius. Okay, so now we're going to go ahead and dissect this rectus femoris. Okay, and now we have the vastus intermedius. Origin for the vastus intermedius. Origin, that's right. Vastus intermedius originates on the femur, proximal. Vastus intermedius originates on the femur. Insertion for the vastus intermedius. That's right. Tibial tuberosity via the patella. You can see it there. For the vastus intermedius. Action. What's the action for the vastus intermedius? That's right. Extends the leg, right? It acts to extend the leg. Okay. Innervation for the vastus intermedius. Yeah, that's right. Femoral nerve. Good. Femoral nerve. Vastus intermedius. Vastus intermedius. Okay. Vastus medialis. and vastus lateralis. Right, those are the three vastus muscles. Okay, let's talk about the sartorius. It's also a muscle of the anterior thigh. Can you locate it? Can you identify it? Origin, insertion, action, innervation. This muscle right here. What's the origin? What's the origin for the sartorius? The anterior superior iliac spine. What about insertion? Insertion for the sartorius. Medial condyle of the tibia. Medial condyle of the tibia. Action. What's the action for the sartorius? That's right. Flex hip, right? It can flex the hip. It can also do what? Flex the knee. Yes, it can flex the knee. Yeah, that's right. A lateral rotator of the hip. Innervation. Innervation for the sartorius muscle. That's right. Femoral nerve. Femoral nerve. Make sure you continue to review, practice rectus femoris, vastus lateralis, vastus intermedius, vastus medialis, and the sartorius. Review, practice origin, insertion, action, innervation.
All right, all right, all right. So we just finished the muscles of the anterior thigh. Let's hop into those muscles of the medial thigh. We got to know those two muscles of the medial thigh. Let's just get into that.
Muscles of the medial thigh. Let's start with this muscle. Let's start with this muscle here. That's right, the gracilis. The gracilis. Let's talk origin, insertion, action, innervation real quick. What is the origin of the gracilis? That's right, os coxa, right? Superior ramus of the os coxa. What about the insertion? The insertion for the gracilis muscle. That's right, medial anterior tibia. Medial anterior tibia. What about action? Action for the gracilis muscle. That's right, adductor of the thigh and a weak knee flexor. Okay, now we're going to talk adductor brevis. Adductor brevis, you see it highlighted there. And just to give you some reference, here is adductor magnus highlighted. Here's pectineus. And so if you peek through those two, you can see adductor brevis. Let's talk origin, insertion, action, innervation for adductor brevis. That's right, adductor brevis, adductor longus, and then just deep to that adductor brevis. And so just deep to the longus would be the brevis right here. So now we can see it like that. Okay, adductor brevis. Okay, origin for the adductor brevis and the adductor longus would be, yeah, pubic ramus. Insertion for the adductor brevis and adductor longus, linea aspera, right? Linea aspera. And then what about action? Action for these muscles, adductor brevis and adductor longus. That's right, adduct the hip, right? Longus, brevis, adduct the hip. Innervation. That's right, obturator nerve. Obturator nerve. Again, highlighted right now is the adductor brevis. On the left side, patient's left, you can see the adductor brevis highlighted. The adductor longus has been removed. Okay. On the patient's right side, your left, you can see the adductor brevis highlighted just deep to the adductor longus. Okay, let's talk about this muscle here, adductor magnus, and let's talk origin, insertion, action, innervation of this muscle. You can see it's a large muscle. Origin for the adductor magnus. That's right. It originates inferior ramus of the os coxa in the ischial tuberosity of the ischium. What about insertion? Insertion for the adductor magnus. That's right, linea aspera of the femur, but it also inserts at the adductor tubercle, the distal aspect of the femur. Adductor tubercle, you can see it peeking through there. Adductor magnus. What is the action for the adductor magnus? That's right, powerful adductor of the thigh. Innervation. Innervation for the adductor magnus. That's right, obturator nerve and also tibial nerve. So 2 nerves for the adductor magnus. So that pretty much sums up our muscles of the medial thigh. We've talked about the adductor magnus, the gracilis muscle, we've also talked about adductor brevis, and abductor longus. Muscles of the medial thigh. Continue to practice and review those.
All right, let's get into muscles. There's a lot of information. Muscles of the leg. Once we finish out those muscles of the leg, we can move into those cranial nerves and foramina. And hey, a few more hours, and you will be taking that exam. Let's get right into it. Muscles, lower limb. We're hitting up the legs right here. Okay, and we're gonna go over this over and over again. So if you miss any of this, it's all good. It's all good. I'm gonna highlight the muscle, and you can practice naming the muscle. All right. So this muscle here, what muscle is this? That's right. It's the gastrocnemius or gastrocnemius, depending on your professor. Origin. What's the origin for the gastrocnemius? That's right. Medial, right? Medial and lateral condyles of the femur. What about insertion? That's right. It's going to insert on the calcaneal tendon, also known as the Achilles tendon here. And then that's going to run down and insert. That's right, right there. Okay. So gastrocnemius, origin, medial and lateral condyles of the femur. And then the insertion for the gastrocnemius. That's right. On the calcaneus via this tendon, the Achilles tendon, the calcaneal tendon, okay? What about action? Action for the gastrocnemius. What does it do? That's right, plantar flexion. It'll help hold the body upright while standing. Okay? That's the gastrocnemius. What nerve? What nerve? Yeah, tibial nerve. Good. Tibial nerve. Tibial nerve innervates the gastrocnemius. Okay? And we're going to go over this over and over again. So if you miss any of this, it's all good. It's all good. What muscle? Yeah, what muscle is that? Yeah, soleus. That's the soleus. The soleus. Let's talk origin, insertion, action, innervation for this muscle. All right? Soleus. Origin. Soleal line of the tibia. Insertion. That's right. Calcaneal tendon or Achilles tendon. And then what's our action for the soleus? What does it do? Soleus. That's right. It's also going to help in plantar flexion, and it's also going to assist in holding the body upright, against that line of gravity. Okay? Soleus. Gastrocnemius here and the soleus here, those two muscles are considered superficial muscles of the posterior leg. Next, we'll look at some of the deeper muscles of the posterior leg. So we're going to remove the gastrocnemius. Let's zoom in here. We're going to remove this Achilles tendon. We're going to remove these the soleus. Okay. And here we have these deep muscles of the posterior leg coming up next. That's right. Tibialis posterior, flexor digitorum, and flexor hallucis longus. Coming up after this short break. These deep muscles of the posterior leg, remove the skin. We have, what's the first muscle we'll see? That's right, the gastrocnemius right there. Right? Boom. Calcaneal tendon, but it's also known as the Achilles tendon. Okay? So we have that. We have this muscle here. That's right, the gastrocnemius. And then just deep right there. Just deep to the gastrocnemius. What's that? Soleus. The soleus. And we also talked origin, insertion, action, and innervation. But we're going to keep moving. So there's that. That's right, the soleus. That's the soleus. Good. And so now what we're going to do is we're going to remove the gastroc and the soleus to reveal the deep muscles of the posterior leg. Okay, so let's remove these superficial muscles. Gastrocnemius, let's get that out of there. That's the Achilles tendon. Let's do it bilaterally. Okay, so here's this one. There we go. You see?
Cool. So let's get those soleus muscles out of there. And just deep to that soleus, we have these deeper muscles. This muscle here, and this one to make sure. Let's remove this skin here too. The skin right here on the foot and the ankle, just so we can see the insertion of those muscles. There we go. Let's do both sides. Okay, there we go. I left that on one side. And on the other side, the left side, you can see now these three muscles that we're going to talk about. These are those deep muscles of the posterior leg. Okay? The tibialis posterior here. That's right. We're going to talk origin, insertion, action, innervation for this muscle. The tibialis posterior. Tibialis posterior. Remember, deep to the soleus muscle. Tibialis posterior. Okay. This is the muscle we're talking about. Tibialis posterior. What's the origin for the tibialis posterior? That's right. Posterior tibia. Insertion. Yeah, plantar foot. Plantar foot. What about the action? What does it do? What does it do? Plantar flexion, right? Also, we have inversion. Inversion of the foot. So that's our tibialis posterior. There you go. Origin. That's right. Posterior tibia. Tibialis posterior. Insertion. That's right. Plantar foot. Plantar foot. Action. What's the action? That's right. Plantar flexion, an eversion of the foot, and innervation. Innervated by the tibial nerve. That's right. That's the flexor hallucis longus. Origin. Origin for that muscle. That's right. Yeah, fibula. Posterior fibula. Let's check that out. Yeah, right there. Flexor hallucis longus originating on that bone. Originating on the fibula and inserting the big toe, the hallux. Flexor hallucis longus. Action. What's the action for the flexor hallucis longus? Yeah, it flexes. It's going to flex that big toe, that hallux. One more thing. Innervation. Innervation for this flexor hallucis longus. What nerve innervates this muscle? That's right. Tibial nerve. So you see right there, the flexor digitorum longus. So origin for this muscle, yeah, posterior tibia. Good. Posterior tibia, origin for the flexor digitorum longus. What about insertion? Inserts on the digits. Digits 2 through 5. This one here, what is that again? That's right. Good. Yeah, tibialis posterior. Tibialis posterior. Originating posterior tibia, inserting on the plantar foot. Tibialis posterior, action plantar flex, inversion of the foot. Innervation tibial nerve. The deep muscles of the posterior leg are innervated by the tibial nerve. Okay. Even the soleus and the gastrocnemius, those superficial muscles of the posterior leg. So all posterior leg, tibial nerve. That's right. Tibialis anterior. Extensor hallucis longus. And then, that's right, extensor digitorum longus. Okay, so let's talk origin, insertion, action, innervation of these muscles. Let's start with the tibialis anterior. So the tibialis anterior is going to originate where? That's right, the lateral anterior tibia. Insertion for the tibialis anterior. Tibialis anterior, insertion. That's right, plantar medial foot. What about action? Dorsiflexion and inversion of the foot. Innervation. What's the innervation for the tibialis anterior? Deep fibular nerve. Tibialis anterior. That's right. That's our extensor hallucis longus, insertion, action, innervation for this muscle. Extensor hallucis longus. That's right. The extensor hallucis longus originates on the fibula. How about the insertion? The insertion for the extensor hallucis longus. Where does it insert? That's right, on the hallux. Action. What does it do? What's the action for the extensor hallucis longus? The extensor hallucis longus extends the toe, the hallux, the big toe, only. Innervation. Yeah, deep fibular nerve. Muscles of the lateral leg. We'll start off with this muscle here. Yeah, fibularis longus. Fibularis longus. Good. Fibularis longus. Origin, insertion, action, innervation for this muscle. Yeah, the head of the fibula. You can see the origin there. Fibularis longus. And it'll insert where? That's right, on the plantar surface of the medial foot. What's our action? Yeah.
eversion of the foot, right? Eversion of the foot, and then innervation, superficial fibular nerve. So, one more time, fibularis longus origin. That's right, head of the fibula, insertion. That's right, medial, plantar surface of the foot, action, eversion. Good, eversion of the foot. Innervation. That's right, superficial fibular nerve. What muscle is that? Yeah, that's right. Fibularis brevis. Origin on the fibula. Insertion for the fibularis brevis. On the lateral foot. What's the action for the fibularis brevis? Inversion of the foot. Okay. And then what about innervation for the fibularis brevis? Yeah. Superficial fibular nerve. There we go. Right on. In this last hour and a half or so, we've covered. And real quick, let's review all these muscles of the legs. Just go through them real quick. This muscle here, excuse me. That's right, gastrocnemius. Gastrocnemius, right there. Okay. How about here? Yeah, the soleus. Okay, soleus. Let's keep moving. Good job. This muscle here. How about this muscle here? Yeah, tibialis anterior. Good. Tibialis anterior. Tibialis anterior. How about right here? What muscle is that? Yeah, good. Extensor hallucis longus. Okay, let's keep going. How about here? That's right. Extensor digitorum longus. What about, let's remove these. Let's remove the soleus, the Achilles or calcaneal tendon. This one, what muscle is that? That's right. Good. Flexor hallucis longus. How about here? What muscle is that? That's right. Tibialis posterior. Here again. Yeah. Flexor hallucis longus. Here. The flexor digitorum longus. Tibialis posterior. That's right. Flexor hallucis longus. Right, all right. Let's get into bones. I didn't slide that in here. I'm gonna go ahead and slide it. We're gonna do bones of the lower limb, and then we'll hit up those cranial nerves. Uh, yeah, okay. What is going on? This is Anatomy Review and Practice, Virtual Cadaver Lab. I'm Mac, and I'm here to just kind of guide you through some review, some practice of the muscles of the lower limb. We'll hit up the hip region, posterior thigh, anterior thigh. We'll also get into the legs. But right now, what we're going to do is review these bones of the lower extremity. So we'll start with the os coxa. Here you see os coxa on your screen. You should be able to identify this. And we'll just go through the bony landmarks of the os coxa. You know, os means bone, coxa means hip. So here you have your hip bones. And we'll go through these landmarks together. Okay, so right up here at the top, you see right here, what is this landmark here? And this is a review, this is practice, that's right, iliac crest, the iliac crest, right there. We have a lot of muscles that will articulate with that iliac crest, you see there. Okay, let's keep moving, Our next landmark, right here, yeah, what is that? That's right, anterior superior iliac spine. Anterior superior iliac spine. Good. Anterior superior iliac spine. What about right here? This landmark here. You see it here. That's right. The anterior inferior iliac spine. Anterior inferior iliac spine. And you know there are muscles that will articulate with that landmark as well. Let's keep moving. How about here? This hole here, this space. What do we call this? That's right. Obturator foramen. Good. Obturator foramen. Let's keep moving. How about here? This landmark here. Yeah, right here. There's a little opening here. That's right. Acetabulum, right? Or acetabellum, depending on your professor. But that little opening there, that hole there. Yeah. Acetabulum or acetabellum. Okay, let's keep moving. How about here? That's right, iliac fossa. I kind of gave you that one. But the iliac fossa, yeah, that's a landmark. You don't want to know. Iliac fossa. Okay, let's keep moving. Let's break this bone. You know, it's two os coxa come together to form the pelvic girdle, right? So you have the two os coxa, and then you have the sacrum, right? That sacrum there, and those form the pelvic girdle. Let's take a look at one os coxa, right? One os coxa, which of course are three fused bones, right? So if we look at this here, here's our os coxa here, these three fused bones. You can see how they come together in the acetabulum. But this bone here, that would be your, that's right, ischium. That's right. Pubis. Right. So this is ilium, right? Ilium. I think I said ischium. Ilium. Pubis. Right? Pubis. And then here, that's right, ischium. There's your ischium. You have that ischiotuberosity. Okay? So again, ilium,
Same on both sides. Ilium, pubis, pubis, ischium, ischium. Okay? I like looking at it this way because you can see where they come together right there in the acetabulum. Ilium, ischium, pubis. Okay. So if we have this, if we take this view here, dorsal or external surface on the left, pelvic surface on the right, we can now label some of these bony landmarks. So if we're this bony landmark here on the dorsal surface, that's right, posterior gluteal line, right? The posterior gluteal line. And then here, that's right, anterior gluteal line. Anterior gluteal line. Das coxa. And how about here? Yes, inferior gluteal line. Good. Inferior gluteal line. Let's keep moving. How about here? We covered this one already. This is a review. That's right, acetabulum. Acetabulum. And here, this hole here. We've also reviewed this today already. That's right, obturator foramen. Obturator foramen. How about here? This point right down here on the ischium. That's right, ischial tuberosity. Ischial tuberosity. Good. Let's keep moving. How about here? This point here. On that pubis bone. Yeah, that's right. That's the pubic. That's right. Pubic symphysis surface. The surface of the pubic symphysis. Let's see. The surface of the pubic symphysis. Okay. How about here? You see that little arrow there? Flashing. That's right. Lesser, right? Lesser sciatic notch. Lesser sciatic notch. How about here? Yes, iliac ischial spine. Ischial spine. How about here? You know this one. That piriformis muscle passes through here. That's right. Greater sciatic notch. Greater sciatic notch. And here, the surface area here. What do we call that? The surface area. That's right. Articular surface, right? That's where it articulates with the. That's right. Sacrum. Yes. Sacrum. And then, of course, we have that. This is the iliac fossa. The iliac fossa. This is that anterior surface. All right, let's keep moving. Let's take a look at pelvic sexual characteristics. Pelvic sexual characteristics. Let's take a look at that. You see female on the left, male on the right. With the female. All right, so let's, subpubic angle, 80 or more. Ischial spine far apart for the female, closer together for the male. Pelvic brim. That's right. Oval shaped for the female, rounded for the male. So we said subpubic angle 80 or more degrees on a female and less than 80 degrees on a male. Ischial spine, the ischial spine far apart. Ischial spines are far apart on the Female. Ischial spines are close together on the male. Pelvic brim. Pelvic brim, we said oval shaped on the female. Pelvic brim is rounded on the male. And then when we're talking about these coccygeal vertebra, you're going to have 3 to 4 on the female, while you'll have 4 to 5 on a male. And then, yeah, the pelvic outlet. The pelvic outlet is rounder for a female. And it's going to be slightly oval shaped for a male. Okay. All right, let's move in and talk about this bone here, the femur bone. Okay. And if we look at this, we have some bony landmarks on here we're going to want to identify. Here, this landmark right here. That's right, the head of the femur, right? The head of the femur, good. Head of the femur. And then if we look here, this landmark here, yes, fovea capitis, one of my favorite. Fovea capitis. How about here? Yes, the neck, right? That's the neck of the femur. Good. It's the neck of the femur. All right, we're moving. How about here? Yes, greater trochanter, right? Greater trochanter. Good. Greater trochanter. What about here? This landmark here. That's right. Intertrochanteric line. How about here? This point here. That's right. Lesser trochanter, right? Lesser trochanter. And here, medial epicondyle down here to give us some reference of where we are. Distal. And then this landmark here. What do we call this? That's right. Abductor tubercle, right? Abductor tubercle. For those medial muscles of the thigh. Abductor magnus. Let's keep going. Down here. This landmark here. Yes. Patellofemoral surface. That patellar bone will articulate with that. How about here? Over here on the lateral side of this bone. Yes, lateral epicondyle. And yes, this is an anterior view of the femur. Let's take a posterior view of the same bone. So this is the posterior surface of our femur bone. Posterior surface. Let's come on. This is a review. So some of these landmarks are the same ones we just covered. But that's okay. Up here. That's right. The head of the femur. The head of the femur. How about here? Yes. Lesser, right? Lesser trochanter. And in here. In this region here. Yes. Abductor tubercle. What about here? This line going down the posterior surface of this bone. Yeah, that's right. Linea aspera. Good. Okay. How about here? This landmark right here. Yeah. Gluteal tuberosity. Good. Gluteal tuberosity. Okay. In here. That's right. Greater trochanter. Right? Greater trochanter. Here. What about here? This is a review. You know this. That's right. The neck. The neck of the femur. And of course, this is a posterior view of the femur. You may want to know these landmarks. Always check your notes. Always check with your professor. But these are some of the basic landmarks of this bone. Several muscles articulate with these landmarks. So You'll definitely hear these when you're reviewing origins, insertions. Next bone. Next bone. This bone here. Yeah. I have it highlighted in blue on the right. Yeah. What bone is this? That's right. Patella. Patella. Good. Patella. And you have one on both sides. There's one here. Patella. This is an anterior view of the patella. So let's cover tibia and fibula. You try it. Tibia and fibula. You see here, this are those two bones. And we're going to go over some bony landmarks on these two bones. Starting with this landmark here on the tibia. What is this? On the tibia. That's right. Intercondylar eminence. How about here? This landmark here. This surface landmark. Yeah. Medial condyle, right? Medial condyle of the tibia. Medial condyle of the tibia. How about here? This landmark here. One of my favorites. Maybe yours too. Yes, the tibial tuberosity. He's getting tongue-tied today. Tibial tuberosity. How about here? Yes, medial malleolus. Medial malleolus. Don't forget that. And here, yeah, tibial plafond, right? Tibial plafond. How about here? That's right, lateral epicondyle. Okay. Posterior view of the tibia and fibula. Some of these landmarks we're going to review that we've just reviewed, but hey, this is practice. So what's this landmark here? That's right. That's the lateral condyle of the tibia, right? Lateral condyle of the tibia. How about this landmark here on the fibula? Yes, the head of the fibula, right? That's the head of the fibula. Let's keep moving. Landmark down here, distal end of this fibula. Yes, lateral malleolus. Lateral malleolus. Good. Lateral malleolus. How about here? This landmark here. That's right. Medial malleolus. Medial malleolus. Good. Medial malleolus. Here. This line here. One of my favorite landmarks. Yeah, that's the soleal line. And here, up top of that tibia. Yep. Medial condyle. Medial condyle. And of course, this is a posterior view of the tibia and fibula. Let's move into the bones of the foot. Bones of the foot. We'll move into bones of the foot. Here they are here. And we have landmarks here. Yeah, distal. Distal what? Phalange, right? Distal phalange. What is this one? Middle. That's right. Middle phalange. And then finally we have this proximal phalanges. And you have those on digits 1 through 5. Of course, digit 1 only has 2 phalanges. You're going to have a proximal and a distal. But the other 4 digits will have proximal, middle, and distal. How about here? These bones here in this region. That's right. Metatarsals. Metatarsals. Good. Metatarsals. 1, 2, 3, 4, and 5 metatarsals of the foot. How about this region here? These bones in this region here. That's right. The tarsals. Those are the tarsals. Okay. How about this bone here? That's right. Talus. And then this bone back here. Yes. Calcaneus. Calcaneus. All right. And that's it. That's anatomy review and practice. That's all I have for you as far as the osteology. Of course, we can also get into more detail, but I wanted to give you a review. I wanted to just touch on it A lot of these you'll see again on your exam, possibly. So definitely review. Next, we'll get into the muscles. Muscles of the lower limb. Muscles of the lower limb, we'll talk about origin, insertion, action, innervation.
Cranial nerves. Cranial nerves and foramina. Let's touch on those real quick, and then that should take us out. Of course, if you have any questions, specific questions, go ahead and shoot those out. We're live right now, so I can definitely answer those for you or try to answer them. If I don't have the answer, I'm gonna find it for you. That's just how I do. All right, so cranial nerves and foramina. Let's get it. Let's start at the olfactory foramina. Can you identify it? That's right. If we zoom in here, right? Olfactory foramina. And the olfactory foramina is for what cranial nerve? What cranial nerve? That's right. Cranial nerve number 1. Cranial nerve number 1, the olfactory nerve, passes through the olfactory foramina. Good. This is just a review. This is just practice, review. Okay, how about the optic canal? The optic canal. Can you identify the optic canal? Optic canal. That's right. Optic canals are located here. And what cranial nerve goes through the optic canals? That's right, cranial nerve number 2. Cranial nerve number 2. What's the name of cranial nerve number 2? Optic nerve. Right, optic nerve. Go through the optic canals. Cranial nerve number 2. Okay, how about the superior orbital fissure? Superior orbital fissure. Can you identify that? The superior orbital fissure. Superior orbital fissure. Superior orbital fissure. Superior orbital fissure. What cranial nerve will pass through the superior orbital fissure? What cranial nerves? Superior orbital fissure. That's right, cranial nerve number 3, 4, 5, 1, right? And 6. So cranial nerve number 3, 4, 5, 1, and 6. So 3 is what? What's the name of cranial nerve number 3? That's right, oculomotor nerve, right? Oculomotor nerve. What about cranial nerve number 4? What's the name of cranial nerve number 4? That's right, trochlear nerve. Trochlear nerve, cranial nerve number 4 passes through the superior orbital fissure. What about cranial nerve number 5, the first branch? That's right, ophthalmic branch, right, of cranial nerve number 5. Cranial nerve number 3, 4, 5, 1, and 6 pass through the superior orbital fissure. Number 6, that's right, abducens, right? Abducens nerve. Abducens. Cranial nerve number 6. So we have oculomotor nerve, trochlear nerve, trigeminal nerve, the ophthalmic branch, and the abducens nerve, okay? All passing through the superior orbital fissure. How about here? What foramen are these? That's right, foramen rotundum, right? Foramen rotundum. What cranial nerve passes through foramen rotundum? That's right, the maxillary branch of cranial nerve number 5. So 5-2, the maxillary branch of cranial nerve number 5
passes through the foramen rotundum. Okay, how about these? These highlighted here. That's right, foramen ovale for, that's right, the mandibular branch of cranial nerve number 5. So 5-3, the mandibular branch of cranial nerve number 5 passes through foramen ovale. How about here? How about these holes here? That's right, internal auditory meatus, right? Internal auditory meatus. Cranial nerves number, that's right, cranial nerve number 7 and 8 both pass through this internal auditory meatus, right? So cranial nerve number 7, what's the name? What do we call that nerve? That's right, facial nerve. Facial nerve. Cranial nerve number 7 passes through the internal auditory meatus. And then cranial nerve number 8, what's the name of that nerve? And there's a few, so that's right, vestibular-cochlear nerve for cranial nerve number 8, or auditory nerve, or acoustic nerve. Okay, so you can have vestibular-cochlear for cranial nerve number 8, or auditory for cranial nerve number 8, or acoustic for cranial nerve number 8. Okay, but cranial nerve number 7 and 8 both pass through the internal auditory meatus. How about here? Right down in here, I'll zoom in on the right side. This foramen here. Jugular foramen. Jugular foramen. Okay? Jugular foramen. What cranial nerves pass through the jugular foramen? Yes, cranial nerve number 9, number 10, and number 11. Those cranial nerves all pass through the jugular foramen. Cranial nerve number 9, 10, 11. What's the names for those nerves? What's the name for cranial nerve number 9? Cranial nerve number 9 we call glossopharyngeal nerve. Good. Glossopharyngeal. Good. What about cranial nerve number 10? What's the name for cranial nerve number 10? That's right. Vagus, right? Vagus nerve. Cranial nerve number 10. Vagus. Cranial nerve number 10. What about cranial nerve number 11? What's the name for cranial nerve number 11? That's right, accessory nerve. Accessory nerve. Cranial nerve number 11 passes through the jugular foramen. Accessory nerve. So again, 3 nerves passing through the jugular foramen. Cranial nerve number 9, glossopharyngeal nerve, cranial nerve number 10, the vagus nerve, and cranial nerve number 11, the accessory nerve. Those 3 nerves pass through the jugular foramen. How about here? Now zoom out and zoom back in. That's right. Hypoglossal canal, right? Good. All right, hypoglossal canal is for cranial nerve number 12. Good. Cranial nerve number 12. And what's the name of that nerve? Yeah, hypoglossal nerve, right? Hypoglossal nerve.
All right. All right. All right. I didn't hit the bones, facial bones. So let's touch on those facial bones. I think we'll close it out. It's around in 7 a.m. right now. We started around 5:30 a.m. You know, for those of you who are early birds, you know. But we're gonna finish out with facial bones. And again, this is recorded, so you can always go back and review. And next session after the exam, we're going to start talking about the heart, respiratory. We're going to get into digestive. We're going to have a good time. All right, let's get these facial bones and then take a break. and get that exam done.
Move part of this calvarium or the skull cap so we can look into the cranial fossa and review the foramina that we have in the cranial fossa. Okay, so let's remove this bone here, and then if we go on this side, we'll also remove this. What bone is this? That's right, parietal, right? Parietal, paired bones. So you can see we can look through the parietal bones, so we can see those foramina in there. But we're gonna go ahead and remove this, okay? Now we have access and we can see into the cranium. And we know there are 3 fossa, right, that contain all the foramina we need to know. So we have this fossa here. What is this called? That's right, anterior cranial fossa. Good. We have here, this fossa here. What do we call this? That's right, middle cranial fossa, right? The middle cranial fossa. Now this final fossa here, what do we call this? That's right, posterior cranial fossa. Posterior cranial fossa. So in the anterior cranial fossa, we have the ethmoid bone. And we know that this ethmoid bone has a landmark, and I'm going to highlight it, and we're going to review the different landmarks on this ethmoid bone. So here, this landmark here, what do we call this? The one highlighted here. That's right, those are the olfactory foramina, right, in the cribriform plate, or the olfactory foramina in the cribriform plate. Okay, so ethmoid bone, olfactory foramina in that cribriform plate. How about this landmark here? This landmark here. Crista galli, right? Crista galli. Right there, Crista galli. Good. Okay. So remember, we have olfactory foramina there and that anterior cranial fossa, right in that ethmoid bone. Okay. Okay, let's move to the foramina in the middle cranial fossa. That's right, optic, right? Optic canals. Those are the optic canals. Optic canals, good. How about here? What do we call these? You see highlighted there in blue. What do we call those? That's right. Superior orbital fissures, right? Superior orbital fissures. Superior orbital fissures. You can see them also from an anterior view of the skull. Superior orbital fissures. How about here? Foramina rotundum, right? Foramina rotundum. foramina rotundum. How about these? Foramen. You see them highlighted there? That's right. Foramina ovale. How about these? Here. You see them? Yeah. Right there. What is that one? That's right. Foramina spinosum. Right? Foramina spinosum. How about here? What do we call these foramina? That's right. Foramina lacerum. Foramina lacerum. Posterior cranial fossa. Okay, posterior cranial fossa. These holes here, what do we call these? Internal auditory meatus. How about here? That's right. Jugular foramina. What do we call these holes? It's pretty neat. That's right. Hypoglossal canal. Hypoglossal canals, right? Hypoglossal canals right there in the posterior cranial fossa. How about here? In this posterior cranial fossa, we call that. That's right. That's the foramen magnum, right? Foramen magnum. Hey, that concludes our review of the cranium for now. We reviewed anterior, middle, and posterior cranial fossas with all the foramina and other holes within them. Hit me up. I'm here to help you.
Yes. It's 7:08, and believe it or not, we've gone through pretty much just about all the material for the anatomy exam. Of course, always check with your professors. Check your notes. Check your lab notes. Your lecture notes. All of that, because at the end of the day, you want to put the answer that your professor wants on that exam. Let's go. Talk to you later. Again, we're going to get into heart. We're going to get into respiratory. We're going to get into digestive. We're going to get into reproductive organs. All that stuff's coming up in the next section. So excited. Really happy to be back. It was touch and go there for me for a while. I didn't know if I was going to make it, but here I am. Let's get it. Talk to you soon. Do well in your exam. I know you're going to ace it because you review and you practice daily. Get it.